body has an immune system, which is essential for our survival. The ocean of pathogens present in our environment can be harmful for us, especially more susceptible to an individual with a weaker immune system. Foreign invaders such as pathogens, chemicals, pollens and such that can be found in our bloodstreams can be destroyed when your body has produced a lot of antigens and antibodies, which are substances that binds together to neutralize any potentially harmful foreign invaders or substance to our bloodstreams. Immune system protects our body from viruses like that of the human immunodeficiency virus or the HIV and acquired immunodeficiency syndrome or the AIDS or the late stage of HIV. When HIV is left untreated, the person is more likely to develop this disease. So it is necessary for an individual to be aware of his/her immunity condition. People who are active with their sex lives are more likely to develop this virus, especially when an individual who's having a sexual intercourse to their sexual partner have no knowledge about HIV and AIDS at all, or even a little background about the said disease. Based on the result of the 2013 Young Adult Fertility and Sexuality Study or the YAFS conducted by the University of the Philippines Population Institute or the UPPI and Demographic Research Development Foundation, 1 in every 10 Filipina teen aged 15 to 19 years old is already a mother. Further, 2.6% of Filipina teens in the same age group are already pregnant with their first child, while 13.6% have begun childbearing. Aside from teenage fertility, it is also worth noting that the sexual behavior of today's youth aged 15 to 24 years old. Among the males, 3 out of 4 have ever watched pornographic movies and videos, while only 2 out of 5 females have done the same. In terms of engaging in premarital sex or PMS, more males have engaged in PMS at 35.5% compared to females at 28.7%. The growing population of the Philippines is caused by the lack of knowledge of the Filipino teenager about sex education. It is important for a teenager or a mother to know and have an access to sex education, likewise to the maternal care they deserve. The Responsible Parenthood and the Reproductive Health Law or RH Law, and officially designated as Republic Act No. 10354, is a law in the Philippines which guarantees universal access to methods on contraception, fertility control, sexual education, and maternal care. The implementation of this bill is very helpful and life-changing. In accordance to the growing population of the Philippines, HIV and AIDS statistics are also increasing proportional to years. As time goes by, more and more Filipinos of all ages are being affected by the virus that can acquire through sexual contact, blood transmission, by breastfeeding, or it can be passed to children at birth. Hence, the mortality rate are also expanding. Here are the statistics of data gathered from 1990 to 2018 of the people living with HIV of all ages. The next chart shows that the data of the newly reported HIV infection estimates of all ages from 1990 to 2018. The last one is the AIDS-related deaths of all ages from 1990 to 2018. As you can see, the proportionality of years and numbers is correlated. Since 1984, where the first case of the virus was ever reported, HIV and AIDS have been an enemy and a threat to our lives. Now let's know what is HIV and AIDS, where it originated, and what are the underlying contents why this disease is deadly and incurable. This is Monica Dumlao reporting.
So thank you for that wonderful discussion or presentation you have there, Ms. Dumlao. So I am King David Lucero, and I will be the next presenter of, or the reporter about the background of the HIV. So the HIV really originates from the chimpanzee in West Africa in 1930s. That is what the scientists had believed. So the scenario is that when the hunters hunt the chimpanzee and kill the chimpanzee, the blood of the chimpanzee had contact with the hunters. So the hunters acquired, or the hunter acquired the virus from the chimpanzee that they didn't even know it. So after that, the virus spread not only to Africa, but also to the whole world. So in my case, that first, I believe that the virus of HIV had started or originates from the man who had sex in a cave to a monkey, and eventually the man that has gotten into the peoples, they had sex and eventually spread the virus from that monkey. So I'm going to discuss about from the year of 1981 to 2019 of what is the happenings about the about the history or the background of the HIV. So in 1981, they had discovered the first case of the HIV, or in that year they called it the gay-related immune deficiency, or the GRID. And the first case of, or the first patients of this virus had pneumonia and signs of cancer. So they called it gay-related immune deficiency because they thought that it can only affect gay men. So next is the 1982. The disease was been renamed the acquired immune deficiency syndrome, or AIDS. That the scientists realizes that the virus is not only affecting gay men but also women, because it can be sexually transmitted. So in 1983, scientists, they had completely discovered that it can affect women. So in 1986, the scientists also discovered that when the mother have the virus of HIV, and when they have a child who is still breastfeeding, so the child can acquire the virus itself because from the breast milk. So in 1987, the antiretroviral drug AZT was approved by the US Food and Drug Administration. So in 1998, they held the first World AIDS Day on December 1, 1998. So in 1990, they calculated that from 8 to 10 people worldwide have living with the HIV cases. So in 1991, the red ribbon that you can see in such commercial or hospitals that they have, the red ribbon became the symbol or the international symbol of HIV or AIDS awareness. So in 1996, Dr. Mark Weinberg, he contributes some of the development of a new candidate for the vaccine, or the 3TC. So in 1999, WHO announced that AIDS is the fourth biggest cause of death on the whole world. So they estimated that the 33 people are living with HIV and 14 million have died because of the HIV. So in 2000, the UN or the United States, they developed a goal on which it pertains of helping to reduce or prevent the HIV, malaria, and TB. So in 2005, the rapid HIV tests had been approved by the Health Canada, wherein it lies in the Canada. So in 2010, the Dr. Kelly discovered the new vaccine for a new vaccine candidate for the HIV. So they look up into that this can lower or prevent the virus from spreading. So in 2011, a man named Timothy Ray Brown had been cured by the treatment after 4 years of treatment because of HIV. So in 2012, FDA approved the HIV preventive drug, the PrEP exposure or prophylaxis or PrEP, for individuals with high risk of HIV infection. So in 2014, UNAIDS initiated or launched the 90-90-90 targets, wherein in the 90% of people living with AIDS has to be diagnosed. So in 90% and to the 90% of those diagnosed has to be accessing medical treatments. So in the last part of the 90% of those treatment to achieve viral suppression by at most 2020. So in 2017, the Truvada or tenofovir plus FTC was approved in Canada. They added it up as their formulary. So in 2019, the NIH announced that they developed a new tool to scale the success of HIV cure strategies. So from the 1930s, from the start of the epidemic and up to now, we can all see that the virus is, or the action of us has been greatly affecting to prevent the virus from spreading. So here's Jello Contapay to continue the reporting. So Jello.
So for health activism or health advocacy, it is giving importance to the people and their families here in our country when it comes to their healthcare and safety. So it is their privilege to do whatever they want as long as when it comes to their healthcare and safety, and they have the right to do them. So I'm going to talk about health education. Health education is the knowledge that is imparted to the people, and its main focus is to care about health. So in this area of profession, it includes environmental health, social health, physical health, and as well as reproductive and sexual health.
Mary Lexing S. Montalan, causes of HIV. Under the causes of HIV, we have 8. First is multiple sexual partners. The more sexual partners you have, the high possibility of getting an HIV, especially if you do not know that the person you have sexual intercourse with has an HIV. The infected person's bodily fluid might be passed to your body, which is why HIV is being transmitted to other people. Number 2 is the unprotected sexual intercourse. Having sex without a barrier or condom in particular, the bodily fluids of your sexual partner can be passed through your body, which I told earlier is the main reason why most likely you can catch HIV. Third is the mother-to-child transmission. There are many ways that HIV might be passed on to the baby. First is through the mother's blood. The blood of the mother could pass onto the baby's body, and the second is through breastfeeding. HIV is also active in the mother's breast milk. That's why, if the mother who has an HIV breastfeed her child, then the HIV might be passed on to the baby. And according to the advert.org, there is a 15 to 45% chance that the baby can be transmitted by HIV. But taking the correct treatment during pregnancy can lower the risk. Number 4 is the sexual abuse. One of the examples of this is a sex trafficking. The victim of sex trafficking has no idea if the person who they have sexual intercourse with has HIV, since they are forced to have sexual intercourse with those people that they do not know. If the person they have sexual intercourse with has an HIV, then they are most likely to be infected too. The 5th is blood donations. This cause is very rare, but if a person who is an HIV positive donate blood that is not tested, the person who receives the blood product is likely to develop an HIV infection too. But in order to prevent this, health regulators require all blood donors to test or scan their blood products before they are used. That's why, if you are thinking about donating blood but are not sure about your HIV status, better request an HIV test first before donating. 6 is injecting drugs with a needle that has an infected blood. During injection, some blood goes into the needle and syringe. A needle and syringe that is used by someone living with an HIV can contain blood with a virus in it. And if it is used again to the other people, then the person who will be injected will likely to be infected too. It is better to ensure that the needles or the syringe that are used are disinfected and clean. 7 is the existing illness. If you have an existing illness, most likely your immune system is damaged and weak. Your body cannot or inability to fight infections and diseases like HIV. You can easily infected by this type of infection. And lastly, substance use. The excessive use of alcohol and drugs affects your brain, and you may be more likely to make poor decisions that put you at risk of getting or transmitting HIV, such as having sex without a condom, have a hard time using a condom, have a hard time using a condom the right way every time you have sex, or have more sexual partners like in the first causes, or use other drugs. These behaviors can increase your risk of exposure to HIV and other sexually transmitted diseases. Now that's all for the causes of HIV.
Good day. I am Dennis Joyce R. Crisostomo, and I will be discussing the symptoms of HIV and AIDS. But how can you tell if you have HIV? The only way to know for sure if you have HIV is to get tested. You can't rely on symptoms to tell whether you have HIV or not. So what are the symptoms of HIV? There are several symptoms of HIV. Not everyone will have the same symptoms because it depends on the person and what stages of disease they are in. So now, here are the 3 stages of HIV and some symptoms people may experience. Stage 1, acute HIV infection. Within 2 to 4 weeks after infection with HIV, about 2/3 of people will have a flu-like illness. This is the body's natural response to HIV infection. Those symptoms can include fever, chills, rash, night sweats, muscle aches, sore throats, fatigue, swollen limbs, and mouth ulcers. These symptoms can last anywhere from a few days to several weeks, but some people do not have any symptoms at all during this early stage of HIV. But take note, don't need to do is to have an HIV test. The second stage is the clinical latency. In this stage, the virus still multiplies, but at very low levels. People in this stage may not feel sick or have any symptoms. This stage is also called chronic HIV infection. But you can still transmit HIV during this stage even though you don't have any symptoms. And it's important to see your healthcare provider regularly to get your viral load checked. The last stage is the AIDS. If you have HIV and you are not on HIV treatment, eventually the virus will weaken your body's immune system and you will progress to AIDS or the acquired immunodeficiency syndrome. And this is the late stage of HIV infection. Symptoms of AIDS can include rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groins, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids. And also, you can have memory loss, depression, and other neurologic disorders. But it doesn't mean that you're already an HIV positive just because you have these symptoms. Each of the symptoms can also be related to other illnesses. The only way to know for sure if you are an HIV positive is, of course, to get tested. Next, I will be tackling about the HIV testing in the Philippines. We all know that HIV is rising in the Philippines, especially in the urban areas like Metro Manila. The lack of information on how to get tested is a major contributing factor why HIV is spreading like wildfire. So here are the best option for you to get tested for HIV or AIDS in the Philippines. First is the public hospitals, for this is the most common and accessible method of HIV testing in the Philippines. Next is the free HIV testing sites. Third is St. Luke's Medical Center HIV Clinic. Of course, this is much better than public hospital and free HIV testing sites, but only if you have 1,200 pesos. Fourth is the Medical City Area Clinic. Medical City is one of the few hospitals in the Philippines that has its own HIV treatment facility. Basically, same as St. Luke's Medical Center, but they are just more specialized. And last but not the least is the HIV test kit.ph. According to my research, the best way to get tested is just to test at home, but please be careful of buying HIV home test kits online, especially in OLX, Shopee, Lazada, or eBay, as most of them are bogus, inaccurate, or just comes with no accuracy data or certification to back them up. HIV Test Kit Philippines offer a Japan-made test kit called Fuji Bio HIV home test kits that is 100% specific in testing HIV, and result is already seen in just 10 minutes. The kit costs 875 pesos and the site contains all the details and instructions on how to use it and how to read the results. And that's all. Thank you.
Michael A. Jamal. I am assigned to report the effects of human immunodeficiency virus and the sexually transmitted infection diseases. The human immunodeficiency virus, or the HIV, destroys the CD4 plus cells, which are critical to your immune system. CD4 plus cells, or the helper T cells, who are arguably the most important cells in adaptive immunity, are responsible for keeping you healthy from common diseases and infections. As HIV gradually weakens your natural defenses, signs and symptoms will occur. There are three categories in the effects of HIV. These are the physical effects, psychological effects, and the socio-economic effects. Physical effects, these are the changes during HIV. Body may have an abnormal collection of fat that result in humps on the back of the neck, breast enlargement, and protuberant bellies. Other physical changes are the loss of fat under the skin in the arms and legs that result in the appearance of the prominent veins in the extremities and flattening the buttocks and sunken cheek. In the psychological effects, one of the most common mental health conditions that people living with HIV face is depression. Depression can range from mild to severe, and the symptoms of depression can affect the day-to-day life of people living with HIV. Both HIV-related medical conditions and HIV medications can contribute to depression. Other mental health conditions include anxiety disorders, mood disorders, and personality disorders. But these mental health conditions or disorders are unexpected or uncommon. In the socioeconomic effects, stigma and discrimination exist. Over 50% of people living with HIV reports to experience discriminatory attitudes. They experience prejudice, negative attitudes, and abuse from the people who surrounds them, especially neighbors and co-workers who knows their condition. Our research has found out that in 50 countries, at least 1 in every 8 people living with HIV is being denied in health services because of stigma and discrimination. The possible consequences of HIV-related stigma are the loss of income and livelihood, loss of marriage and childbearing options, poor care within the health sector, withdrawal of caregiving in the home, loss of hope and feelings of worthlessness, and loss of reputation. With homophobia at the beginning of HIV epidemic in many countries, gay men and other men who have sex in men are being hated because they were said to be responsible for the transmission of HIV. Even in the press, the headlines such as "Alert over Gay Plague" and "Gay Plague may lead to blood ban on homosexuals." They are demonetized and spreading hatred to the LGBT community. In gender inequalities are more severe for marginalized women, including female sex workers, transgender women, women who inject drugs, migrant women, and women with disabilities who are also at the heightened risk of discrimination and violence. In unemployment, it was found out that the most common reason for the loss of job or work of the PLWH or people living with HIV was their illness. These issues may not only affect the livelihood of the people living with HIV, but also the economics of the country. Lastly, the rejection by family members. 84.8% of Inder patients experience rejection by family members, and 33.33% among married Inder patients with HIV reportedly were blamed for spouse illness and had strained relation with in-laws and spouse, respectively. Sexually transmitted infection disease, or STI or STD. These are contracted primarily through sexual contact, vaginal, oral, or anal sex. There are 2 types of STI or STD. The first type is bacterial. Bacterial diseases can be treated with medical drugs like antibiotic. Bacteria can reproduce on their own. Bacteria can also survive in different environments including extreme heat and cold, radioactive waste, and the human body. Most bacteria are harmless and some actually help by digesting food, destroying disease-causing microbes, fighting cancer cells, and providing essential nutrients. Less than 1% of bacteria cause diseases in people. There are 4 bacterial STDs. The first bacterial STD is the chlamydia. This is caused by bacterial infection that grows within the body cells. Symptoms include swollen testicles, discharge, burning during urination. Women may experience no symptoms but may result in sterility as it damages the uterus, ovaries, and the fallopian tubes. Second is the syphilis. Infects the genital area and other parts of the body including the brain. Symptoms are sores that appear on or in the genital area and can spread to the other body part and the brain. Symptoms include a firm, round, small, and painless sore on the genital, anus, or mouth, or a rash on the body, especially on the palms of the hands or the soles of the feet. This can cause paralysis or even if it left untreated. The third one is the gonorrhea. This is caused by bacterial infection called gonoccal bacteria that attack the lining of the mucous membrane and grows rapidly in warm, moist areas of the body, mostly mouth, anus, throat, and genitalia. Symptoms in men are a foul-smelling, cloudy discharge from the penis, burning upon urination. In women, inflamed cervix and light vaginal discharge. Trichomoniasis or the trich. It has no symptoms but may cause unusual genital discharge for both men and women. The disease can also increase a person's risk of acquiring HIV, and pregnant women can deliver premature, low birth weight baby. The second type of STD is viral. Viral are not treatable or curable. Treatments can only help with symptoms while you wait for your immune system to fight off the virus. Or like bacteria, most viruses do cause disease and they're quite specific about the cells they attack. For example, certain viruses attack cells in the liver, respiratory system, or blood. In some cases, viruses target bacteria. There are 4 viral STDs. The first one is the famous HIV. It is one of the sexually transmitted disease from unsafe, immoral sex and promiscuity. Symptoms are not reliable to tell if a person has HIV. The second one is the genital herpes. It is caused by the herpes simplex virus. Symptoms may be the sores on the genital area, itching, burning, throbbing, pins and needle sensation where sores are about to appear. Genital warts. Genital warts is caused by human papillomavirus or HPV. Symptoms is the wart growth on the genitalia. This is a one silent killer among the list of sexually transmitted diseases, for it is asymptomatic, unrecognized, or subclinical, and yet a leading cause for cervical cancers among women. Lastly is the AIDS. Sexually transmitted viral disorder that causes deterioration of immune system and eventually result in death due to complicating infections that body can no longer fight. Infections caused by direct contact with body fluids such as blood transfusion, breastfeeding, and sexual intercourse. It is caused by human immunodeficiency virus or HIV. Symptoms are severe malfunction, eventually breakdown of the immune system. The methods of transmission is sex with infected person, sharing needle with infected person, and giving birth or breastfeed while infected. Both bacterial and viral infection are caused by microbes. Microbes can spread by things such as coughing and sneezing, contact with infected people, especially through kissing and sex, contact with contaminated surfaces, food and water, contact with infected creatures including pets, livestock, and insects such as fleas and ticks. Microbes can also cause acute infections, which are short-lived, chronic infection, which can last for weeks, months, or a lifetime, a latent infection which may not cause symptoms at first but can reactive over a period of months and years.
Hi, my name is Nathaniel Cecilio R. de Guzman, and let's discuss the healthy lifestyle. A healthy lifestyle is a way of living that lowers the risk of being seriously ill or dying early. Not all diseases are preventable, but a large proportion of deaths, particularly those from coronary heart disease and lung cancer, can be avoided. Health is not only just about avoiding disease, it is also about physical, mental, and social well-being. When a healthy lifestyle is adopted, a more positive role model is provided to other people in the family, particularly children. They measure the benefits with critical health numbers including weight, blood sugar, blood pressure, and blood cholesterol. Healthy living is a lifelong effect. Being healthy includes healthy eating, physical activities, weight management, and stress management. Good health allows people to do many things. How to promote a healthy lifestyle? Balanced diet, pattern break, exercise, drink more water, get enough sleep, balancing spirituality. And this is kind of promote a healthy lifestyle, because lahat naman tayo gusto maging healthy and malakas na pangangatawan para hindi tayo nagkakasakit palagi.
Other tips for safer sex. Safer sex is also about having sex when you and your partner are ready and having sex that enjoyable, respectful, and protective. Ways that you can practice safer sex include having sex with you only and one partner when neither of you has any STI. It's the safest way to have sex. Be STI free by getting tested for common infection and having treatment if necessary, especially if you have a new partner. Avoid sexual contact until the doctor or nurse tells you what you are no longer infection and until both you and your partner have been treated. Communicate with your sexual partner about what you want to enjoyable sexuality. Be aware that drugs and alcohol may affect your ability to make good decisions. Protect yourself from having sex that you might regret or were pressured into because you were thinking properly. Use other types of contraception in addition to a condom to avoid unplanned pregnancy. High risk or unsafe sexual activities. Unsafe sex outside of a monogamous relationship increase your risk or getting a STI. Example of unsafe sexual activities include having sex without a male or female condom, withdrawing the penis before ejaculation instead of using condoms, trying to
I'm Andre Ebreo, and I'll be talking about the 5 key areas in health promotion and education and 5 health promotion approach. Five key areas in health promotion and education. Number 1, promote social responsibility for health decision. Number 2, increase investments for health development. Number 3, consolidate and expand partnerships for health. Number 4, increase community capacity and empower the individual. Number 5, secure an infrastructure for health promotion. Let's go with the first one. Promote social responsibility for health decision. Higher authorities must be firmly committed to social responsibility. Both public and private sectors should promote health by pursuing policies and practices that avoid harming the health of individuals and also benefit the society and promotes the quality of health in our country. Each one of us has the responsibility in promoting health in our society, so all of us must do our part. Number 2, increase investments for health development. Increasing investments for health is equivalent to a better quality of health services. In many countries, current investment in health is inadequate and often ineffective. Some of them don't put support and enough budget for health promotion, therefore it can result to a lower quality of life in their country. Greater investment for health and reorientation of existing investments, both with and among countries, has potential to achieve significant differences in human development and health and quality of life. Next is consolidate and expand partnerships for health. Health promotion requires partnerships for health and social development between the different sectors at all levels of governance and societies. For you to understand, partnerships is equals to benefits, and more benefits is equals to more quality of health. Therefore, in terms of health, the higher the quality of health services and promotion will be acquired in our country if there will be more partnerships. Next is increase community capacity and empower the individual. Health promotion is carried out by and with people, not on or to people. To make it easier to understand, all of us has responsibility in health promotion. As an individual, you can promote health to your sibling, to your family, or even to your classmates. And as a higher authority in government, they can put laws and other campaigns for health promotion. Lastly, secure an infrastructure for health promotion. To secure an infrastructure for health promotion, new mechanisms for funding it locally and nationally and globally must be found. An infrastructure for a certain program is like a cornerstone for them. So, securing an infrastructure for health promotion will help them develop it more, and after that it will result to a better quality of life in a certain country. Next is the 5 health promotion approach. We have medical approach, behavior change approaches, educational approach, in-client-centered approach, societal change approach. That's it. Let's go with the first one. Medical approach. The freedom from disease and disability as defined by medical, such as infections, disease, cancer, and heart disease. So, let's relate it to our topic. HIV testing centers is one of medical approach. Each one of us must know if we have HIV, or each one of us has the right to know if they have it. Or in current times, COVID testing centers is one type of medical approach too. Next is behavior change approaches. To change community attitudes and individual behavior so they took this healthy lifestyle. For example, teaching people how to stop smoking, look after their teeth, and eat the right food. As an individual, we can do this. Like, we can encourage our family to eat healthier, or to schedule a checkup for monthly checkup for our family to ensure healthy lifestyle. Next is educational approach. To provide information and ensure knowledge and understanding of the matter of health. The aim of education approach is to provide individuals with information, ensure knowledge and understanding of health issues. One example of this is sex education. I know a lot of people is disagreeing with this, but certainly it's just a misunderstanding, and it's one example of educational approach. Teaching sex education can prevent a lot of diseases and human inherited virus from spreading because it's providing information and ensure knowledge to younger peers or students. And if you promote health through that way, it will expand more and improve our quality of life. Next is client-centered approach. This approach is to work with clients to help them identify what they want to know and do, and make their own decisions and choices according to their interests and values. This is self-empowered client. This is like a one-on-one health promotion, like a doctor and its patient. As a patient, I want to know what's wrong with me or how I can live better. So, in client-centered approach is one health promotion example that can be done to me in order for me to know how can I live healthier and to know if I have such sickness. Next is societal change approach. To make changes in the physical environment, social and economic development in order to make it more conducive to a healthy state. One example of this is health campaigns. Societal change approach is like a bigger scale health promotion, and the one responsible for this is the higher authorities because they can provide health campaigns such as HIV testing or promoting sex education. That is one, and of course some free checkups in barangays. That is one example of societal change approach. That is all, and thank you.
So for the RH law or the reproductive health law, its main focus is to give access to people in using contraceptives, fertility control, birth control, sexual education, and maternal care. So, for example, in using condoms, pills, and other things that are related to their reproductive health and their safety. So I'm going to talk about health education. Health education is the knowledge that is imparted to the people, and its main focus is to care about health. So in this area of profession, it includes environmental health, social health, physical health, and as well as reproductive and sexual health.
Hello there, and I'm going to tell you about the infographics of HIV and AIDS. In this part, we talk about the causes, effects, and symptoms of HIV and AIDS, and what we have to do when we have HIV and AIDS. So, what is HIV or what is AIDS? HIV is a virus that attacks the human immune system, the body's natural defense system. Without a strong immune system, the body has trouble fighting off this disease. Both the virus and the infection it causes are called HIV. So what causes HIV? Most people get the virus by having unprotected sex without someone who has HIV. Another common way of getting it is by sharing drugs, needles, with someone who is infected with HIV. The virus can also be passed down from a pregnant woman to her baby during pregnancy or birth or breastfeeding. So, what are the symptoms of HIV? The symptoms are fever, sore throat, headache, muscle aches and joint pain, swollen glands, and skin rash. HIV may not cause symptoms early on. Early on. People who do have symptoms may mistake them for the flu or monocommon early symptoms. Symptoms may appear from a few days to several weeks after a person is first infected. The early symptoms usually go away within 2 to 3 weeks. After the early symptoms go away, an infected person may not have symptoms again for many years. After a certain point, symptoms reappear and then remain. The symptoms usually include swollen limbs, nodes, extreme tiredness, weight loss, fever, and sweats. So, when we have HIV, when we go to the doctor, a doctor may suspect HIV if symptoms last and no other cause can be found. If you may have been exposed to HIV, your immune system will make antibodies to try to destroy the virus. Doctors use tests to find these HIV antibodies or antigens in urine, saliva, or blood. If a test on urine or saliva shows that you are infected with HIV, you will probably have a blood test to confirm the results. Most doctors use a blood test to diagnose HIV infection. If the test is positive, it means that HIV antibodies or antigens are found. A test to detect HIV DNA or RNA will be done to be sure. So, how can we prevent HIV? Just like I said before, unprotected sex. So, practice safer sex to use condom every time when you have sex with, let's say, people who you do not know or you just met in the bar. You should always use condoms when you have sex until you are sure that you and your partner aren't infected with HIV or other sexual transmitted infection. And the second part is do not have more than one sex partner. So it means that at a time the safest sex with is with one partner who has sex only with you. So it means that you don't need to change, you don't have to have another sex partner. Just stick with one because it will be safer to prevent an HIV. And of course, talk to your partner before you have sex for the first time and find out if he or she is at a risk for HIV. Get tested together, use condoms in the meantime so you can be safe. Don't share personal items such as toothbrushes or razor because that will also spread the virus. Never share needles or syringe with anyone. Just like I said before, HIV can be passed by needles, and of course the blood of the infected person may go inside you, then you will get infected by the HIV. So when you have an HIV, what do you have to do to stay healthy or safe? So one thing is for sure is eating healthy. Nutritional advice for people living with HIV is the same as for people with a negative status. Eat balanced diet without too much processed fat, sugar, or salt. This will also help your body to absorb the treatment and fight off the infection every day. And second is exercise regularly. Being active is part of maintaining your health for everyone. It means building muscles, keeps your bones strong and heart healthy, and it also burns fat. Some people who are living with HIV lose muscles, mass, and strength. Exercising regularly helps prevent this. Exercise also reduces feelings of stress and symptoms of depression. So that is it for the infographics, and that is all that you have to know about it. Thank you.
Good morning. My name is Terence Mark M. Salazar. We are now going to discuss what are the things that you can do if you already have HIV and AIDS. First thing is to have a regular exercise, to have a healthy body that can help to fight against the virus. The second thing is eating healthy foods and having a proper diet, because it helps your body for your recovery. And the most important thing is that you should go to a doctor first, so that they can give you a proper support and give you a prescribed medication that you will need for your recovery. And you can also help yourself by being positive and reducing your stress that giving you a negative thoughts and being hopeless. And the most important thing is by the help of your family, because they are the one who will understand you and give you a support. And now the question is, what are the things that you can do to avoid having HIV and AIDS? Is that having a proper practice of safe sex. And second is avoid having a multiple partner. Third is being wise when choosing a partner, and take it very seriously. And that's all. Thank you for listening and watching.
What is the role of Adamson University and STP in combating HIV and AIDS? As discussed earlier, the causes of HIV Most of those causes are about having sexual intercourse with different people, especially the people who you really don't know. Premarital and extramarital sex is under that kind of cause. And safe sex will help lower the risk of getting and transmitting HIV to other individuals. That's the role of the Adamson University NSDP. Their advocacy is to reduce the risk of HIV and AIDS by conducting various programs to spread awareness and educate the students in terms of having safe and protected sex wherein sexual intercourse will only occur at the right time or when the two individuals are married. Since Adamson University is a Catholic school, they are very protective when it comes to marriage and family life. With that, Adamson University is against premarital sex or sex before marriage and extramarital sex or having sexual intercourse with other people other than the spouse. Here are some of the programs of Adamson University in combating HIV and AIDS. Last March 23, 2019, Adamson University conducted a forum in partnership with LoveYourself.inc in advocating HIV and AIDS awareness. And second is in last March 16, 2019, Adamson University Red Cross Council, together with the Center for Health Services, conducted an HIV awareness and prevention at the BA Multimedia Adamson University.